I'm Norman Lamb, former Minister for Care and Support, and it's a pleasure to speak to you today via this link. I'm really sorry I can't be with you, but it's a cause close to my heart, and I was very keen to contribute. So I've met many bereaved families over the years and heard really tragic stories, particularly about deaths that could have been avoided. Now, I've got immense admiration for Jane and the team for the incredible work that they've done over very many years and for the extraordinary progress that they have made. Now, it was 21 years ago that Epilepsy Bereaved, as it was then known, brought together the clinical world and the research world to set up the first global summit on sudden deaths. And that in turn led to the whole issue being written up in a respected medical journal. And what in turn happened was that we were able to explode the myth that people did not die from epilepsy. Now, there was an audit undertaken, and this was a really significant moment. And it established the fact that 4 out of 10 deaths could have been avoided through better education in what to do and in better access to healthcare. Now, what then happened was that guidelines were established for clinicians. GPs were paid to do annual checkups, which is really important. Now, the main recommendation about risk management from the audit was not taken up by the government, but it had nonetheless a significant impact on government thinking and on thinking within the NHS. Now, the summit today is a remarkable indication, a mark of the extraordinary progress that you as a community have made. And the fact that the UK is in a unique position to lead the way now in making further improvements and in saving lives. Now, we know that the NHS is challenged in so many ways, but it is nonetheless a remarkable system, and within it there are pockets of really excellent practice within epilepsy services, and we can learn from those and disseminate that learning to the rest of the country. But the national data remains shocking and makes the case for continued and urgent action to confront the fact that too many people still die unnecessarily as a result of having epilepsy, and this is not necessary. This could be avoided. So what I would say to you is keep up the remarkable work that you have been doing over so many years. Continue to lead the way internationally, and through the work you do, through the lessons we learn from the deaths that have tragically happened, we can save lives in the future and make a massive difference for families across our country. So I wish you well over the next day and a half. I hope it's an immensely successful conference. Wherever you are from whilst attending this conference, you are here because you care and because you can make a difference, and I admire that immensely. Thank you very much indeed, and have a good conference.